p.m. We'll go ahead and call the meeting to order. Thank you all for coming out tonight. Ask Commissioner Stewart if you'll lead us in the invocation and the pledge.
Please stand and join us. Heavenly Father, we come to you tonight as leaders of our community, ordinary men making decisions in a troubled world. We are reminded in 2 Chronicles 7:14 that if my people who are called by my name will humble themselves and pray and seek my face and turn from their wicked ways, then I will hear from heaven and will forgive their sin and heal their land. Tonight, Lord, we humble ourselves. We ask you to forgive our sins and heal our land. Without your wisdom and intervention, it seems our land is doomed. Give us wisdom tonight to help us make good decisions. Bless our state and our national leaders as well, and turn their hearts towards you. We pray all this in your name. Amen.
Amen.
Heavenly Father,
A pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Y'all supposed to all pray with me.
We need all the prayer we can get. All righty. Do we have any changes to the agenda?
Yes, Mr. Chairman. At the request of Mr. Jacob Ross, he's the second presenter, he would like to table that to the 9/6 meeting, please.
All righty.
I'd like to pull number 8.
Number 8.
Mr. Chairman, if it pleases the board, in order to preempt any sort of presentation from Public Works, I'd like to move 11 general business to consent. About the vacuum truck, I think we've all heard a lot about the vacuum truck.
We got any speaker cards on it? Everybody good with that?
Sorry, guys.
Unless y'all just want to talk.
David, you don't have your presentation to make?
No, sir.
That won't hurt your feelings?
That won't hurt my feelings.
Okay.
Do we have a motion?
So moved.
Second?
Second.
All in favor? Aye.
Aye.
Opposed? Passes 5-0. All right. I'd like to thank you all for coming out tonight. If you'd like to speak, we've got a Citizens to be Heard session at the beginning and one at the end. You can speak on either one. Please fill out a speaker card with Miss Patty. You can also speak on each. Well, we don't really have any agenda items now, do
Number
we?
8. Jerry pulled number 8.
Yep, there we go. Number 8's the only other one. When you come up, give us your name and your address and speak into the microphone so the folks at home can hear you. So we'll start out with Mr. R.H. Carter.
Start and end with RH.
Well,
Hi, I'm R.H. Carter. I'm from Crawfordville, Florida. I want to talk with you tonight about your allocation to the senior citizens. A year ago, I came before you and I asked for an increase of $20,000, and y'all approved it. After it was approved, y'all began to discuss. You felt like it should just be for 1 year. And I understand there's been some discussion in budget workshops since this year already about that subject. I'm here tonight to make a request to you. We are in a position we can make it through the year without any of it. I'm asking that y'all reduce it from $20,000, keep 10 of it this year, and at the end of next year, keep the other 10,000. Right now, we're financially stable and can carry forward throughout a year, with one exception. Each month, we spend a lot of money. Then we get a lot of money back from the state the next month, and that works well as long as it happens that way. But along around November, December, January, and February, funny things happen then. The agencies send our request to the comptroller's office, but the money doesn't come to us. That means that we have to have some extra money to carry on when we don't get our reimbursement. You have no control over that, and we don't have any control over that. So I'm asking you to take that $20,000, keep 10 of it this year, take the other 10 a year from now. And I think by then we'll be in good enough shape. We will not be asking for any increases in allocation for quite some time. That's the current situation. Thank you.
thank you, sir.
Let me ask you, I know we have to have a 5-0 vote on something like that?
I'm not voting on it, Jerry.
Okay. All right.
We can discuss it at budget time.
Mm-hmm.
I don't think we need to do it now.
Yeah,
We got to approve the whole budget in its
Mhm.
entirety anyway.
not saying I'm adverse to it, but I say I'm not going to get a 5-0 vote right now.
Thank you, Mr. Carter.
Thank you.
That ends our Citizens to be Heard. We'll go into awards and presentation. Our presenter tonight is Mr. Tanner Cash with Wakulla Medical Center.
Good evening, Commissioners. How are y'all doing? I was just here, coming in here. I haven't talked to y'all in a couple months. I just wanted to give y'all an update on Wakulla Medical Center. Let y'all know that we actually have a new provider that's joined our practice along with Dr. Carry On. It's Dr. Karen Bartley back here. We brought her with us this afternoon. Dr. Bartley, she attended medical school at the University of South Alabama, and after that she completed her family medicine residency at in Bristol, Tennessee, and began practicing in 1997 independently. She's obtained a wide range of experiences that I think will prove beneficial to our community and to the center as well, which include rural and remote medicine, hospice care, teaching medical students such as nurse practitioners, pharmacy, young family medicine practicing students. So we're seeing about teaching students down at the center and everything like that. Right now, Dr. Bartley, she sees newborns to end-of-life patients, so we're able to see a wide range of patients at the center. Dr. Bartley, the only thing that's holding us up right now with her being able to see to her capacity of patients is our credentialing for her insurance plans. We're still waiting for all that to be pushed through. Right now, she can see slide fee patients, Blue Cross Blue Shield, CHP, Medicare, straight Medicaid, and full pay patients. We're still waiting on our Medicare and Medicaid HMO plans to be approved. That can take anywhere from 30 to 120 days. So we're just in that little crunch period waiting for that. After that, we plan on doing a lot of advertising throughout the community, in newspapers. We just put a billboard up in Crawfordville actually, so just to let her know that we're there and we can see a lot more patients. I know Dr. Stanridge at TMH actually recently moved up to Southwood, so there's a lot of patients without a primary care physician I think now in Crawfordville, because whenever Dr. Stanridge left, he was not able to bring all his patients with him. So it's really nice to have Dr. Bartley on board with us.
School in L.A., huh?
Oh, not L.A., University of South Alabama.
Or Alabama.
And then along with Dr. Bartley joining our team, we are doing extended hours now. So Monday through Thursday, we're open from 7 to 4 versus the normal 8 to 5 like we were typically in the past. So patients that need lab work can come in a lot earlier before they have to go to work. Helps them out with that. We're not closed for lunch Monday through Thursday, so we're open all the way from 7 to 5 on those days. Friday, Dr. Bartley does not work, so she's doing 10-hour days for Monday through Thursday, so Dr. Bartley will be our only physician in the office on Fridays, and we're open from 8 to 5 on those days. We've seen a large increase in our patient encounters since the addition of Dr. Bartley. In June, we've increased 22%, July 34%. So we're definitely getting the numbers in there and being able to give back to the community, help them establish primary cares down here rather than having to seek it elsewhere in Tallahassee. So each of our providers, they do have 4 same-day slots. So while we're not a walk-in clinic, we do have 4 same-day slots available for each of our patients or each of our providers. So we're able to see up to 8 patients on a same-day basis. And then as well, if we do have a walk-in and our schedule can accommodate it or the provider can accommodate it, we'll try to fit them in as we can. But we can't see any more than what the physician's allowed or able to see in one day, though. So and as well, we've increased both of our reception staff and clinical support staff to accommodate the addition of Dr. Bartley. Like I said, we're going to be doing some new advertising campaigns just to promote the center as soon as the credentialing is passed through. And then, as well, just to close, our current licensed clinical social worker at the office, Stanley Mitchell, he'll actually be retiring in October, so we are now doing new recruiting for a licensed clinical social worker at the center to be able to take over Stan's patients. We're going to try to refer him out as we can if we don't have anybody in replacement for him when he leaves, but we're hoping to have somebody there, prior to his departure. So, and Dr. Bartley, did you want to say anything or introduce yourself?
I'm Dr. Karen Bartley. I've been visiting the area for the last 10 years with my husband, and we're excited to now be moved down here and starting jobs and getting settled and being part of the community. So thank you very much.
Welcome.
Yeah,
Thank
welcome
you.
aboard. Thank you for coming.
I have a question, I guess, to the other gentleman who was up here, if I could get him back up. You have one physician?
We have 2 physicians
You have
now.
2 physicians?
Yes, sir.
They're there all the time?
Yes, sir. We have two
Monday through Thursday?
physicians Monday through Thursday
Okay.
from 7 to 5, and then on Friday, 1 provider from 8 to 5.
Okay, now tell me about walk-ins.
Walk-ins, well, we are not a walk-in clinic. We're just like any other
Why?
clinic. Well, I mean, we're just a organization that we don't do walk-ins. We schedule patients in advance, just like any other TMH, Capital Regional.
Yeah, our people in Tennessee especially, they're not able to make appointments in Tallahassee. they're just not able to do that. They, first of all, they don't have the money. Half of them don't have transportation. I know, I don't understand why you can't take walk-ins.
I mean, if it was up to me, I would love to do that, but we're
He did
set.
say he's got
we-
same-day
we're regular-
appointments, four.
Yes, we have
four
8
per doctor.
same-day slots that are available
I'll
for
be
patients.
walk-in, but they can get in same day if they can fit in one of those 8 slots, if both doctors are there.
Yeah, and you're saying you only have 8 slots
8 slots
per doctor per day?
No, 8 slots total, 4 for each
per
physician.
8 slots. This lady's wanting to answer the question, so come on up if you will.
Hi there, my name's Paulina Pendarvis, and I'm the Public Awareness Director for North Florida Medical Centers, which includes Wakulla Medical Center.
Okay, good.
So I think I understand what you're asking. So what Tanner was trying to explain is that we keep 4 slots for each provider available the day of the service. So for instance, if someone were to call Tuesday morning, we should have 4 slots for each provider. That'd be a total of 8 for same day. All the others are scheduled out. So the physicians can see anywhere from 15 to 20 patients a day. So we might be seeing 40 patients in a day, but we try to keep 4 slots per provider available for those same day folks that call and have
Okay,
the
4
flu or a
slots,
cold or whatever.
Tell me why you don't do walk-ins.
We will do walk-ins, but if you're a walk-in, you have to wait until there's a space available because we've already made our commitment to the folks that have an appointment.
It's only,
Basically, we get
only
one of
so
those
many
slots
hours in a
and
day.
wait for 'em.
Only so many slots.
So the walk-in's basically taking one of the same-day appointments. That's
Exactly.
Or if we can work them in. I mean, we do try our best to work folks in. And right now, that's not going to be an issue because we have plenty of capacity.
Yeah. How many patients are you seeing a day total today?
I don't know, Tanner.
Typically both of our physicians are seeing anywhere from 22 to 24 patients a day. Right now, Dr. Bartley's restricted on how many she can see per day due to credentialing for
Okay,
insurance
each
differences.
physician's seeing 22 per day.
22 to 24 per day.
Not total, but per physician
Per
day.
physician, yes.
Okay, good enough. Sounds like you're busy.
Yes. We'd love to be busier.
Thank you very much. That ends our awards and presentation. Do we have a motion to approve the consent agenda?
Motion to approve.
Motion and a second. All in favor?
Aye.
Aye. Opposed? Passes 5-0.
I had number 8.
Jerry, we'll take number 8.
Okay. I just wasn't able to see the recommendations regarding the community center. Can somebody tell me what those recommendations were?
To seek grant funds for.
Oh,
the
just,
community
okay, I pass. I've got it.
Motion to approve.
Second.
Motion second. Any citizens? Discussion? All in favor?
Aye.
Opposed? Passes 5-0. That ends our consent agenda. And no general business, no public hearings, no planning and zoning, no commissioner agenda items. County attorney,
Nothing tonight.
county administrator.
Nothing tonight.
Citizens to be heard, number 2.
What time is it?
Discussion items for commissioners. Chuck, you want to start us off tonight?
I don't have anything for tonight.
Gary?
I don't have anything.
I got 2, sorry guys. Just a couple things that just seem to keep hanging on forever and ever, and I just wanted to run it past you guys and get the will of the board and figure out if this is something that we need to bring back or direct staff to do. The first is landscape ordinance. I'm just getting worn out. I don't know if you guys are getting the same calls lately about,
I had one call from the Rockies guy, that's it.
all right. So, I mean, the will of the board, but I'd like to see us maybe take a look at that, maybe do a workshop and figure out, is that landscape ordinance good as it is? Do we need to make changes? And so that's what I'm throwing out there to see if anybody else is interested in doing that.
I'm not, but
I'm interested.
Me, you, Mike?
I'll listen. I mean,
I'll listen too, but nobody's been complaining to me about it.
The only one I've had, I complained when we built our church down there, but that was years ago.
Right.
And then I had a complaint from the guy at Rockies, and that's been it. But, I mean, we need a standard. Now, is our standard too strict? Maybe it is. I don't know, so I'm willing to listen.
And that's all I'm saying, and I'm not saying that I've got the answers and say, well, we need to add this, take this away, I don't know if we just
I
need
know
to.
that thing has been beat to death, I can tell you that over the years.
Yeah.
It's been revised, I don't know how many times.
Right now, it's a consensus that was come to by a large group of the public, And, opening it back up is, you didn't want long meetings. You're looking at long meetings.
Well, can we possibly take a part of that landscape ordinance and vote that this
Absolutely.
particular part is
Any
whatever?
commissioner can bring back any agenda item to modify an ordinance, as long as you're gonna follow public hearings.
Yeah.
It takes 5, 6 months.
And maybe instead of a workshop, that's the way to do
I
it.
actually do not want a workshop
Okay.
per se, but I would certainly like, one of the things is, just as I heard today from someone, the property has a heavy tree line, and basically we're requiring for him to landscape a heavy tree line that's already there.
That was, and I think I know the person you're talking about, and that person, that was a condition of his approval, that he agreed to, and he said he would do that to get approval.
And that's
So,
not, and that's
as a
nothing to do with the
concession,
last
so if he
landscape
says
ordinance.
that, he was the one that suggested that.
Okay.
And now he's complaining,
I agree, but
Now he's-
doesn't make sense.
but it doesn't matter, if he was the one that suggested
As
it.
a
He said, here's
commissioner-
what I'll do.
What I would
He
suggest,
approved that.
Mm-hmm.
Now he's wanting to back up, and he did that to get the people to agree. Y'all agreed to it and said, yes, if you'll do that, that was his thing.
Right.
And that, you can't do that. You can't back up now. He's got to do what he's committed to do, because he committed that to the people of this county.
if anybody has one specific part, like if you wanna
Yeah.
change it from a 3-inch caliper to a 2-inch caliper,
Right.
any commissioner can bring back an agenda item to do that. I don't wanna revisit the whole thing and say, let's start over.
Well, I can tell you, from an
Let's
industry standpoint, we have a very easy landscape ordinance.
It's a lot easier than Leon.
Very easy.
Yeah.
And it's very cheap.
You may be right, but it seems like I'm getting
Well,
way too many calls.
Well, but if
about
you
it.
notice, yeah, we're only getting a small amount out of all the stuff we're doing. Now, there are some things that we want to look at, like the sidewalks outside of the core of Crawfordville. I think that's one thing we need to look at.
Right.
That's whether to do those. I think one of those was over our fault. We talked about that. That's something that we're wanting to look at. And I think we got to look at maybe some areas, looking at some different areas of different landscaping. And we've got some of that, but that's one of the things we wanted to bring back to y'all, is we got some fixes we need to do.
I think
here.
Commissioner Thomas has a good idea, and I think Randy second on that, is bring back an item.
Individually, we'll
Bring
look
back
at
an
case by
individual,
case item.
Because
Case by
we
case.
don't ever want to go somewhere where we can't, because one shoe doesn't fit all the people. One,
Just simply go talk to Summer. If they're gonna bring back a
Yeah.
revision anyway about the sidewalks, we don't have to have everything done in a meeting. If it seems reasonable, then they
Yeah,
can.
and add it
include that
into
in their
some other
revision.
stuff, and that's what we'll do.
My main thing is, obviously, we can't talk outside of this meeting, so I
Right.
don't know if you guys are getting the same calls I'm getting, but,
I've had one call
Yeah.
in the last 6 years about the landscape ordinance, that was from Rockies.
I
okay.
had the same one that Mr. Moore did, and it was obvious that was a condition of his development.
Mhm.
And so, that's not landscape.
Well, and it was his idea.
Right.
It wasn't ours.
Good enough.
I hadn't even called me.
We'll look at that case by case now.
Yeah.
The other thing, going even further back, and I've spoken to David and to Lee about this, Hidden Meadows. I keep, that keeps coming up. I met with the owner,
Guy Rebel.
Guy Revel, a couple weeks ago, and Guy is convinced that we've got a problem that we need to fix. And there were a couple former county commissioners that were at that meeting when they voted on it. And so my stand is, I don't know who's at fault or
I'll tell you
if
what
anyone's
happened.
at fault, but my thinking is, why in the world would we allow that water to exit somebody's property, whether it's heading toward a sinkhole or not? And so, is
Let me give you a little background on what happened.
It was under common ownership was one of the things.
It was approved as a PUD. The
Right.
PUD required it to have stormwater ponds, right, Summer? So an engineer came back and said, we don't want to do stormwater ponds, we want to do swale exemption, which was legal and fine. But the PUD said they had to do ponds. It got missed somewhere in that transition. There were supposed to be ponds, and there wasn't supposed to be any off-site discharge. I suggested we just go block that daggum culvert that goes to there's a culvert, cross-drain, Chuck, I don't know if you've been out there or not.
I've been out there.
It goes straight to a sinkhole.
It goes straight to the sinkhole, and
Two
we
of them.
need to come up with a solution to fix that.
Pour concrete in the end of the culvert, tear it up.
That's what I think as well.
That's what I had
Is that
suggested.
gonna, now the question is if you do that, is it gonna back up and flood that house that's right there down the road? Because
That's what I hear.
So that's why, you know, a retention pond might be necessary there, because otherwise that house could go underwater. So you're gonna buy one or the other.
We don't have property to put a retention pond there, though, do we? Does the county own property out there?
We'd have to buy a lot, or possibly dig out the swells deeper, wider. I mean, I don't
But
know.
there hasn't been a problem so far.
I think,
And we've already went through a hurricane. And say, guys, y'all are dealing in something that we don't need to be messing in.
well, that
We
is,
need to stay out of that, because it is not, that is something that was, if we touch that, we're all of a sudden on it. Right now, we don't own it.
but yeah, we do. The right-of-ways have been dedicated.
No, but we
to
don't
the county.
own that stormwater system as far as it's designed and by an engineer. We don't, the county does not need to mess with that because, number one, it hasn't violated anything. There's not a violation out there. It was permitted and installed and inspected, and DEP has already signed off on it.
How do
The
we
minute that
allow
we touch it-
anybody to discharge on someone else's property?
That's not us. It was also, that was after it was permitted, it was permitted to where it discharged on the same ownership property. After the fact, the ownership changed. Okay? That's what happened. And so that's not our doings, not
Okay,
at all.
the person who is, the person who's bringing this up will absolutely sue the county.
That's fine. He's
He can do
threatened that
that.
before. Please, because there's nothing he can sue the county for.
Well, with all due respect,
No.
you can sue the sunshine, and
That's right.
9 attorneys will take the case
And let me tell you,
tomorrow.
he's been through a bunch of attorneys. He's been through a bunch of attorneys, and they've yet to sue the county.
All right.
We don't, we
Good enough.
want to avoid a suit.
But that's what I
I'm trying to
mean.
figure out. So when you say that it changed after the fact, it changed with or without a permit,
No, the ownership changed. It was
Okay.
already installed.
okay?
I
So-
thought this property been owned for a long time.
That was all a big partnership. If you look back, there is a deed that came out after the subdivision that went back into Mr. Rebel's name as a payment through to the developer.
With the stormwater discharge.
That's right.
Already going on.
Already going on it. And he carved that out of that. So,
You saying he didn't own those sinkholes at the time?
no,
those-
he did not own them. He was a partial owner of that,
Of the whole thing.
of the whole thing.
Partial owner of Hidden
Of the
Meadows.
Hidden Meadows. Then at the end, he carved that out. So that's it. It was already there. There is no reason, guys, we need to be involved in this whatsoever. He can't sue us. He can sue us.
So you're
but there's
saying
no win.
at the time those culverts were put in there,
Yeah.
it was discharging on the same site?
It was same site. It was there. That's what I'm saying. This is easy. It's not hard. That's the reason we've been consistent on this.
What?
Don't give in to this, because that's all it is. It's real simple.
Well, I don't think we should plug up a drain.
If we mess with it, we're all of a sudden, we own it, and any lawsuit,
That's what
anybody gets flooded down the line, we got it.
That's what I'm saying, so we shouldn't plug up a
This is
drain.
dangerous as a cock gun. It could cost this county millions of dollars if we touch it. Best thing we need is leave it alone.
Here's the responsibility I see we own. The past board approved the PUD with the ponds in, right? As part of the condition of the PUD document was the ponds. Somebody missed it when they got their final approval and those ponds weren't there. That's the only responsibility I can
But
say we have.
I know, but that, in the end of the day, those ponds discharge somewhere. Those ponds were gonna discharge into the same areas. So it doesn't matter. It just went from, instead of having a pond, they used the ponds in the ditches.
I'm not going to
The
get into
discharges are the
argument
same
about
discharge.
engineering, but it could have been attenuation for a 100-year storm with a pond
No,
versus
there
a
were,
swale,
there
which
was,
is a
there were
3-year.
discharges in there.
I understand that.
That's what I'm saying. So it doesn't matter. Whether you put a pond there or not, you still got a discharge. It doesn't matter.
Yes, it does.
But they calculated their stormwater
I'm not
ponds.
saying I disagree with what you're saying, Dave.
They calculated in that, and I'm just saying that because, guys, you'd be entering something here that could cost this county tons of money for no reason.
I'm just saying, if we allowed those to discharge on a neighboring property, there or anywhere,
DEP, not the county.
Yeah, if it's.
Number one, DEP did that, not the
If this was
county.
permitted, we need to go to DEP.
And see, that's the
have them
thing. It's
correct it.
DEP, it's not the county.
Mhm.
And DEP permitted it, DEP inspected it. The county doesn't do any of that stuff. None, nothing. We have nothing to do with stormwater.
They didn't-
And that's where it makes it easy.
They
Tell
didn't-
us, we
They
have
didn't
nothing to do with
They didn't
stormwater.
inspect it. It was a swale exemption.
But they
I've done
inspect,
hundreds of
no,
them
we've got their records where they inspected it, and they
After.
said it was built as per.
after the fact.
And they accepted it. We don't have anything to do with that.
And I agree with you.
I hope you're
I don't
right.
want to be argumentative.
Yeah, I'm just saying, we don't have anything to do with that, guys.
Yeah.
That's not us.
I hope you're right, but I mean,
No, I'll be glad to I know,
I just heard from other county commissioners that were on the board at the time,
Uh-huh.
and they said, what's on the ground is not what we approve.
doesn't matter.
You know?
The county doesn't approve a
That's
stormwater
right.
plan.
And they were right when they said that. That goes back when the PUD was approved, it had ponds.
But at the end of the day, the county does not in charge of stormwater.
What about the final CO? Were we supposed to make sure it complies with?
No, it's at what we don't permit stormwater, period, in the story.
I see what
Never
you're
happened.
saying.
It was on the site plan. I mean,
Doesn't matter.
It's on
It
the site
doesn't
plan.
matter. It doesn't matter.
So they can leave it
We
off the
don't-
site plan?
We don't permit stormwater.
Future site plans, we can just leave stormwater off the site plan?
No, they gotta show stormwater, but at the
I
end of
mean,
the day,
why
we
do
don't
we need
permit
it
it.
on the site plan if we're not gonna make sure
We
it's built
don't,
in accordance with the
no,
approved
we don't
site plan?
permit that. That's DEP's job.
You're agreeing with what I just said, that I think we have some responsibility
Yeah.
because it was approved in the PUD document to
Absolutely
have
not.
ponds,
Absolutely not.
and the final plat got approved. I'm
No,
not
what
saying,
matters substantive in a PUD, and I've been through this, is if you change the use of the land there was a change in that PUD, and all it did was added one lot.
and if that's correct, that's fine.
That's right. So that's all it did, because we went through the numbers. It
Wasn't a
added one
major
lot.
change.
There was not a substantial change in that PUD at all. There's one lot when it changed.
I hope you're right, because,
Ralph, I got it, and you've seen it. You've seen all the stuff. It's right there. It's
yeah,
easy.
but it just doesn't make sense how, you know.
It's all in writing. We've got every bit of it in writing. And you've seen it. Every one of y'all seen it. It's easy. It's right there. DEP
Okay.
permitted. It's DEP's responsibility. Stormwater. Period. End of the day. And once we go in there and mess with it,
Yeah.
we have ownership. Then there's no reason why this county should mess with it. None. All we're doing is
Is that
costing the
culvert in the
taxpayers.
easement? Is that culvert in a drainage easement?
hmm It's all right. Everything's perfect. It's
County owned.
yeah.
Well-
But it was built. It was built as per the permit.
The culvert is right where the retention pond was supposed to be.
Yeah, that's what I'm saying. That all that stuff even retention ponds had outfalls. So that's what I mean. I'm just
So-
saying there's no sense in us.
But if we
don't
wanted
need to be
to-
taking on something that's not our
If
responsibility.
we wanted to do something about this, we would address DEP, or Northwest Florida Water Management, because they now permit
Well, he
this
said they
stuff.
got an exemption, so they got an
They're
exemption.
in compliance with it.
They're in compliance.
At the
But
time,
as
you-
long
And we
as- as long as
actually
they're-
got that in the document from DEP. You're in
it's a
compliance.
swale
Right,
exemption.
Correct.
Most
So-
everybody did a swale exemption back in the day.
That's right.
It's only a 3-year, 1-hour storm design. It's very simple.
Yeah, and that's what those ponds were.
It wasn't
so.
designed for attenuation, which is the requirement now.
Okay, so we agreed that it's not an issue as far as our responsibility, but maybe we should be addressing this as a problem that Northwest Florida Water Management should handle, because it's dumping water directly into a sinkhole and dumping it into our
I don't think
aquifer.
it's dumped any right now.
I don't think it has either. I don't
It
think it's
hasn't
actually
done
flowed
You can,
any
you
water.
can actually see flow.
But here's the thing is that it, and I understand what you're saying, but it's not the actual flow of the land. That is only a short area. That drainage basin would have already went in there anyway. But I understand what you're saying, but understand, we don't need to touch it. Now, if North Florida wants to do it, that's fine.
Well, that's what I'm saying, we should bring it to
That's
their
right,
attention.
that's
If they want to
fine. We
handle
don't
it,
touch it.
fine, but
We leave it alone.
we just, as far as addressing Mr.
That's right.
Rebel's concerned, we should take it to Northwest Florida Water Management and say, look at
We-
this, we
we've
don't think
been-
it was done right, but, if you want to
I'd
do
just
it.
like to get this thing.
Guys, we've been
Solved,
contacted
solved.
by him and his attorneys, multiple attorneys.
Mhm.
We showed them the stuff, never hear another word.
I think
So-
even at the time, I think, even at the time, you couldn't discharge to an active sinkhole. So it may be a simple matter of when Water Management District permitted it, they didn't know that this was going to be discharging, and let them deal with it. And that's fine.
That's what I mean, let them
That's
deal
what I'm
with it. We
saying.
don't need to touch it.
Let's put it on Water Management's
Yeah.
back and let them handle it, because it's
I mean,
theirs.
all we're doing is we're putting a severe burden on our taxpayers if we all of a sudden pick it
I'll
up.
stick by what my philosophy is on the PUD, but,
One-
I don't
yeah.
want to get in a big fight over it.
One thing I would like to see, first I've learned tonight that they were all the same parcel, so I'd like to see that.
we got that.
I'd like to see that, because
Yeah.
if that's the case and they're discharging to their own property, then obviously that's a different,
They were under common ownership, yeah.
Yeah.
I don't know if it was one parcel or two, but it was under common ownership.
Right.
But they still couldn't do that.
Yeah.
Into an active sinkhole?
Oh, I don't know about the sinkhole, but where the water was
Mhm.
going, the person who was developing had the ability to put it on their own land.
And I would assume that the reason it was allowed to go in that sinkhole was, and this is an assumption, is if you look at it, the area that goes to that back sinkhole back in there,
Pretty small.
they look like to me, they said, okay, this is already going there anyway. You know what I mean? If you take your contour lines, they're saying you can't take any more there than what's going there currently.
And if you look at the,
That's an assumption, but that's,
Actually, that swell that they put in there that's part of their stormwater retention part, that's carrying water from the middle of the development all the way down to
it's
that
carrying,
corner.
no, the middle of the development goes, if you look at it, that goes down and
To a
goes
different
into the
wetland.
wetland. That's right.
there's
That's
two.
And from that
But there's
break
a
in that
sinkhole
hill,
down there, too.
and what I'm doing is, I'm just assuming here.
If I
Trust
remember
me.
right, that back sinkhole is what we're talking about. When I looked at it with the contours, it's actually a pretty small basin that
Yeah.
does drain to that.
And the point is I know when they went through the design, you're allowed to, whatever's going there now, it can go there, and that's probably what it was
That's the
designed.
3-year, 1-hour exemption.
That's
It
right.
still, it still discharges where it discharges naturally, but theoretically, it's supposed to.
And I think that's what we gotta look at it.
To treat it.
We need to ask the Water Management District,
do that
is it
today.
discharging any more now
Mm-hmm.
than what it naturally would be? And that's the difference that
No,
we have to make up.
Don't
in the
ask them
pond.
that. That,
Well, I mean-
that, the rule didn't used to say that.
Right,
It says it now, but back when they permitted, it didn't
Right.
say attenuation.
Right.
You can discharge more than it did before, but it just has to be in these
That's right.
swales, which they get a swale exemption. I've done tons of them, so.
Yeah.
I'd like to see that common ownership then,
Yeah.
and go from there.
I mean, they just,
I hope you're right.
yeah.
Make a motion to adjourn.
Well, I think,
We still got,
Oh, please do.
any more discussion?
Only that, I said last meeting that I would bring an agenda item for the road mowing, and I reached out to some of the wildflower folks, and we're gonna I'm gonna work with them, and I'm gonna bring an agenda item. I gave them till November, December timeframe to come up with where they'd like to see designated areas,
Mm-hmm.
and the rest we'll mow full width and
It's just-
clean up the roads and make it safer.
With these designated areas, I mean, they'll still get mowed full width sometime, won't they?
Right, they still will get mowed at certain, but on like once a year, the rest of the
Right.
places will get mowed
As you
4
remember-
times a year. Right now, we're only getting mowed 1 time a year, the whole length of it.
You remember the road to Shell Point, it get wildflowers. I'd hold off mowing that till the wildflowers blooms went away and then
Right.
go mow it.
And so we're gonna work it out. I'll bring something back if you guys can agree with that. If we can't, we'll just mow the thing, or we'll leave it like it was. It was a mess, and if you notice, they went and mowed on 98 the last couple of days, and the mowers couldn't even cut it. It was so bad.
yeah.
It is a
The
mess.
interesting, you go in Taylor County on 98, which I wish went to Orlando, they have a wildflower program, but they mow theirs on a regular basis, and they've actually got a nice stand of wildflowers versus what we've got.
And these guys.
Oh, and after it goes to seed?
Yeah, they mow it on a regular basis, and they have a fairly nice wildflower program.
I'm reaching out, I'm
Yeah.
trying to be decent and work with the folks and just try to make it look better and be safer. That's all I've asked. They agree that it's unsafe, to some degree, and that we need to do something different. They did agree to that, and so we'll come back and see what we get.
I think we would all prefer beautiful wildflowers and less mowing, less maintenance cost, but what we have now is a lot of weeds with a few wildflowers just spread in
I
there.
agree.
Oh, when you go from Taylor County to Wakulla County, it looks like
Yeah.
we don't have any money to do anything.
Yeah, it's a mess.
Yeah, it's a mess. Terrible.
Sounds good.
Motion to adjourn.
All right. Thank you all for
All right.
coming out tonight.
I don't